Hello and welcome back to Module 3, Topic 1, What is Case Investigation? In this module, we're going to be getting into what you're actually going to be doing once you get hired to be a contact tracer. Our objectives of this topic are to define case investigation and contact tracing, understand the definition of a close contact, the definition of a case, and also the steps of case investigation. Case investigation and contact tracing. The goal or purpose of both of these, or if we were to define both of these, we would consider them fundamental activities that involve working with a patient who has been diagnosed of an infectious disease to identify and provide support to people who may have been infected through exposure to that patient. Contact tracing has been around for a while. It hasn't just been developed for COVID-19, but whenever there's some kind of infectious disease that comes out, for example, contact tracing was around when the HIV virus first came out. So it's been around. It's just that we need more right now because we don't have a vaccine for COVID and it has such a rapid spread. Case investigation is the identification and investigation of patients with confirmed or probable diagnosis of COVID-19. A case is defined as a patient that has tested positive for COVID-19. In some literature, they use the word person of interest, a PUI. This is another term for a case. So the main thing here is that a case, this person actually has a positive COVID test. It's pretty positive that this person has COVID-19. When we talk about contact tracing or contact investigation, we consider that the identification, monitoring, and support of the individuals who have been exposed to the case and possibly infected themselves. A close contact is defined as someone who has been within 6 feet for more than 15 minutes, 48 hours prior to them showing symptoms until the time the patient is isolated. We're hoping that once the patient is isolated, they no longer come into contact with any other people. However, sometimes that's not the case, but this is our definition of a close contact. Contact tracing is the key strategy to prevent the further spread of COVID-19. When we talk to cases, our instructions for them are always to self-isolate since they're a positive case. In contacts, most often we tell them to quarantine unless for some reason we call someone and we find out they recently had a positive COVID test. These are pretty much the guidelines for the majority of those that we're going to be coming in contact with. The steps to contact investigation are here. There's 6 main ones. The first 2 steps, the case identification and prioritization and the rapid notification of results or diagnosis, those steps are done by your supervisor or other personnel in charge of those steps. As a case investigator / contact tracer, you're more worried about step 3 right here, which is the case interview. There's different steps. We have 3A, 3B, and 3C, and we're going to talk about those in just a sec. And then steps 4, 5, and 6 we're also responsible for as well. Before we move on any further, it's important to note that when you are on these calls with these contacts or cases, that you always ask open-ended questions or statements when you're interviewing. So for example, the difference between explain to me where you went in the last 2 days versus did you take public transportation? That second question gives the person a chance to just respond with yes or no. That's really not going to get us any of the information we need. So when you ask someone to an open-ended question is any question or statement that you're not going to get just a yes or no answer. So let's get into the steps of step 3, which is the case interview. Now, the main objectives of this case interview are to assess the patient's medical condition, gather information for continued monitoring and support, and also obtain the names and location information for contacts who may have been exposed to COVID-19. During the interview, the introduction, this might be the most important part of the interview because it sets the tone for the rest of the call. It is important to build trust and rapport with the patient. You want to first always introduce yourself, explain the reason for calling, explain the interview process, and begin collection of basic information from that case. Once that's completed, here are some examples of the demographic or locating information you might get from the case. Their preferred name, their gender, phone number, email address. Do they like to be texted? Do they like to be emailed? All this good stuff. And most likely, whatever jurisdiction you work for, they're developing a lot of technology tools or apps right now to assist in this process where you are going to be entering this data into a technological system. Health information. This is where your health and education skills come in from the last module. You want to ask about symptoms and include the date of onset. Ask about recent COVID test. Ask if the clinical course included a hospitalization, ICU, ventilator. By clinical course, that means what has happened since you started symptoms or tested positive, like how severe has your course been. You want to ask about pre-existing conditions, which is what we talked about last module: diabetes, severe obesity, lung disease, liver disease, cardiovascular disease. Is this patient pregnant? Is this patient immunocompromised? These are all things that we need to know. Risk factors as well. Exposure history in high-risk occupations. So is this case that you're talking to, are they a healthcare provider or a first responder? That puts others in their field at risk, and they have to be notified. They go to the top of the list to be notified. Also, does this person live or work in a congregate setting? An example of a congregate setting is a homeless shelter. They could be a resident, or they could possibly work there and have contact with all these people, or a long-term care facility. That's another congregate setting. Places like this, it's like a breeding ground for COVID to get transmitted. So we need to know that information about the cases if that's where they work or had contact with. Monitoring and isolation instructions are going to come next. You are going to advise this case to self-isolate immediately. That means they are trying to be in a room by themselves. In best case scenario, have someone bring them meals and food where they never have to leave unless it's for a medical reason. So self-isolation is you are in your home, you are not leaving unless you have a medical emergency. If the case refuses to isolate voluntarily, the state does have the authority to make it mandatory for these cases. Normally that doesn't happen. It might happen to you on a phone call. That's when you let your supervisor know. But some states are making it mandatory, some aren't. So it all kind of depends the jurisdiction that you're working in their protocol. You're going to educate the case on the symptoms again, and also the symptoms that require immediate medical attention. They have to know the difference. Cases with no healthcare provider need linkage to telemedicine or phone consultation. We have to make sure these cases have some form of contact to contact a medical professional. Educate the case on preventing infection among those living in their household. A lot of times people don't live alone, so we have to educate them on what they need to do. We're going to provide you with these PDFs after this video, so take a look. There's a lot of good information on them. Make sure the documents are provided in the primary language. These are the links for those documents. We're actually going to upload the PDF, so you don't have to worry about these links. The next step, you are assessing the self-isolation support needs. So you're asking the cases these questions, and this is where that rapport comes in, that trust, because a lot of these questions are pretty personal, and sometimes people are reluctant to give you an answer. So some considerations: does the patient have access to a room and bathroom? Does the patient have access to food and water? Does the patient express fear of abuse or violence if they isolate at home? Does child care or elderly care affect their ability to self-isolate? Will social services or housing be needed to support someone who cannot self-isolate? All the answers, you're going to ask the cases these questions. All the answers, you should be trained when you actually get hired to do this job, because every jurisdiction has a different resource available or a different way that they're handling the answers to these questions. So that's all dependent on your jurisdiction. But remember, this is intended for cases who are medically stable to self-isolate at home, is when we provide them these services. If they cannot, this is when we have to recommend that they go to the hospital. A lot of jurisdictions are providing this COVID-19 kit, which includes washable cloth, face covering, so a face mask, gloves, a digital thermometer, alcohol-based hand sanitizer, soap, COVID-19 health education materials, instructions for cleaning, and a hotline number for support. The next step is eliciting contacts. So remember, a contact, as we defined before, is anyone who's been within 6 feet for 15 minutes or more of that person 48 hours prior to them developing symptoms until they were isolated at home. And one other thing to mention here is that it does not matter whether they were wearing a mask or people around them were wearing a mask. If they were within 6 feet for 15 minutes, regardless of wearing a face mask, they are a contact. This is voluntary, but also a critical part of the case interview. People are not required to tell you what they did in the past 2 days or everyone they came in contact with. Some people are not going to want to give you that information for personal reasons, or they, maybe they have an alternate reason why they don't want to give that information. But it is not required. It is voluntary. Determining the contact elicitation window. We kind of talked about this before, but symptomatic, someone within 6 feet of an infected person starting 2 days prior to the illness. Asymptomatic, 2 days prior to the date that they gave their specimen collection of their positive test. It's so important to explain why the close contacts are being elicited. You are getting the contact information because right now this is one of the main methods to reduce the spread of COVID-19 in the world. Actually, there's no vaccine right now. There's no medical way to stop this virus. So what we can do as humans is social distance, wash our hands, wear our face masks. And then also this contact tracing, it has to be fast, it has to be efficient, so people know that they might have been exposed and can either isolate or quarantine as needed. You also want to assure that the patient's name, or assure the patient that their name will not be mentioned to disclose contacts. It is a violation of privacy. You're not going to call this person and say, hey, so-and-so said that you were with them and they're positive for COVID. It's going to say, the conversation is more like, we've received information that you might have come in contact with someone who tested positive for COVID-19. Names will never, ever, ever be verbalized. Here's some case solicitation questions. Again, you can see you're going to have great communication skills and rapport and trust that you build with that patient from the very beginning. Who do you live with? Do you live with your husband? Do you live with your partner? How many people live in your house? How many intimate partners do you have? Have you had close contact with anyone, including coworkers? Were you in a community setting where you might have been exposed, such as public transportation, retail, large community social events, etc.? If someone was in a large community event or a community setting, you want to make sure to get the name and address of that community setting, how long they were there, the date they were there. Because those are settings where a lot of people come together, where the setting most likely needs to be told that they had a positive case there to prevent any future spreading. Contact questions. So this is you in the case investigation eliciting contacts from the case. What is the contact's name? How can we locate the contact? What is their phone number? Their email address? What was the setting of the exposure? So on and so forth. But these are the questions that you're going to be asking the case to get the contact elicitation, to get their contacts. One other scenario that you might encounter is this proxy interview. A proxy interview happens if the case is unable to provide information. And it's unfortunate, but some examples could be that the case is deceased. Maybe they're intubated, maybe they're unconscious. They could be a child. Your supervisor will have this protocol for the jurisdiction that you are working in / working for. Step 4, the case follow-up and medical monitoring. This is actually very important because that first phone call or first contact you have with the case, sometimes they're kind of thrown off and they might remember a few more details the next time you call them. They're trying to take in all this information and how they're going to self-isolate for 10 days. Some things you might want to follow up on are the onset of symptoms, further exploration of occupation and their interactions, transportation to and from work, social and recreational activities. Is the case going to be monitored daily to share daily reports on their temperature and symptoms? For example, are we calling them daily? Or if that can't happen, how are we providing them to self-monitor themselves daily and communicate remotely with healthcare professionals so we know they are okay? When you're talking to patients and you're trying to get information, one good kind of tip is that you can ask them to look at their social media or their old text messages. Sometimes that helps people remember where they've been and who they've been in contact with. Additional case follow-up. This step is needed if a patient is being transitioned from one facility to another. So some examples are from the hospital to their home, or from a correctional facility to their home. And the reason for this follow-up is to protect the community that they're transitioning to. So for example, an elderly patient could be going from the hospital to a long-term care facility, we need to make sure that that patient at their long-term care facility home is not then spreading it to others in their community at the long-term care facility. And then the last step, discontinuation of self-isolation. This is made on a case-by-case basis. Decisions for healthcare professionals to return to work should be made on the context of local circumstances. The CDC recently just changed this, so it was test-based, but now remember it's symptom-based. This slide is assuming that the person was able to self-isolate at home and they had mild to moderate symptoms. So if they were symptomatic and you call and follow up with the patient, here are the 3 criteria. You have had no fever for at least 24 hours without the use of medication. And remember that fever is defined as 100.4 degrees or higher. All of your other symptoms have improved, all of them. And at least 10 days have passed since your symptoms first appeared. If you were one of those people that were asymptomatic, the criteria for ending isolation is that 10 days have passed since your first positive test. And that's assuming that you still didn't develop any more symptoms. Now, for severe or immunocompromised patients, this has recently changed as well. Instead of 10 days, so everything's the same, but we now need you to have 20 days have passed since the date of your test or symptoms. And this is so it's protecting you so you don't go out into the community and get it again, possibly because you're immunocompromised. There are some test-based strategies as well that can be considered, and that's based on whatever your healthcare provider is going to tell you to do. But so if you had like a severe case or were immunocompromised, these are the new criteria to end isolation. So those are the main steps. And let's just review right here. We have a great flow diagram. And remember, case investigation is crucial to prevent the spread of infectious diseases. Here is our flow diagram. So up on the top, you see those 2 circles. The first 2 circles, that's like step 1 and step 2. The case is going to be entered into the data system, and then the case is triaged. Once the case is triaged, someone's taking all this information and they have the criteria where these cases are going to go. Then the case is assigned. Once this case is assigned, so we're right here, the patient is interviewed. You're going to confirm the test results. This is basically step 3 in itself right here, right? Patient identifies contacts, refer patient to medical if they have severe symptoms, refer patient to support services if they need them. Patient continues to self-isolate. Then, after that initial, this is like step 3, step 4 over here, we're going to follow up with the patient daily. If any symptoms worsen or they have those severe symptoms, immediately we're going to refer the patient to the medical provider. And then eventually that case is going to be discontinued when they can end self-isolation based on the criteria we just talked about. If you have any other further questions or you want to kind of explore anything a little bit deeper, these are the websites that you can visit on the CDC, and we will see you in the next topic.